Hello, my name is John Moyer, and I want to welcome you to the NIH Office of Disease Prevention's Mind the Gap webinar series. This series explores research design, measurement, intervention, data analysis, and other methods of interest to prevention science. Our goal is to engage the prevention research community in thought-provoking discussions to promote the use of the best available methods and to support the development of better methods. Before we begin, I have some housekeeping items. You can submit questions during the webinar via the chat pod. You'll need to open the pod by hovering your cursor at the bottom of the Zoom window and then clicking on the chat icon. Please direct your questions to hosts and panelists. We will open the floor to questions that have been submitted via the Zoom chat pod at the conclusion of today's talk. The slides and video recording will be posted on our website, prevention.nih.gov/mindthegap, in approximately 2 weeks. Lastly, we would appreciate your feedback about today's webinar. Upon closing, you will be asked to complete an evaluation. We would appreciate your feedback as it will help us improve this webinar series. At this time, I'd like to introduce Dr. David M. Murray, Associate Director for Prevention and Director of the Office of Disease Prevention.
Thank you, John. Today's speaker is Dr. James Troendle. Dr. Troendle is Deputy Director of the Office of Biostatistics Research in the Division of Intramural Research at the National Heart, Lung, and Blood Institute at NIH. Dr. Troendle received his PhD in mathematical statistics from the University of Maryland, College Park in 1991. Before joining NHLBI in 2010, he was at the Eunice Kennedy Shriver National Institute of Child Health and Human Development for 18 years. He is particularly interested in multiple comparison methods, longitudinal data analysis, and time to event analysis. It's my pleasure to welcome Dr. Troendle, who will speak with us today on alpha spending in clinical trials.
Okay, thank you, David and John, for the wonderful introduction and the invitation to be able to speak about alpha spending for clinical trials. Basically, I'm going to be going through the following topics. I'm going to give a little bit of context as to the type of trials. I'm going to mainly be talking about clinical trials and the context, the type of trials. I'll be giving a little bit of background about the type of error rates that would be important for these kind of trials, family-wise error. A few of the methods that are commonly seen, and maybe many of you may have already used these methods, Bonferroni, stepwise extensions to the Bonferroni, gatekeepers, so another approach to controlling error. I'm going to introduce the graphical approach, which is a very intuitive and simple, I think, approach that can be very useful. Then I'm going to give a couple of examples. So throughout my talk, I'll be using these same examples, and I'll illustrate some of the methods with these examples. And then at the end, I will have 2 actual NHLBI trials as examples for real examples. So basically, the context for which I'm going to talk today is mainly, it's a clinical trial context, and I'm thinking of confirmatory or phase 3 clinical trials. And the issue of alpha spending comes up in relation to multiple primary aims of the trial. So anytime a trial has multiple primary aims, there could be an issue with multiple hypothesis testing, and that's the basic topic that I'm going to be addressing. So that itself can come through in many ways, but 2 are the most likely for people to experience. And so my examples I'm going to go through today when I introduce methods are going to be these 2 kind of very classic examples where they're most likely to come up. And that is when you have multiple primary endpoints. So that would be a 2-arm trial, but it has more than 1 endpoint. And you're interested in either of those endpoints. If you find a difference between the 2 arms, you want to make a claim. And then there's an issue that there's multiple hypothesis tests there that you might want to control error over. The second is when you have a multi-arm trial. So you have a single outcome or endpoint, but you have multiple arms, and you may want to, if there's at least 3 arms, and that means there could be many outcomes. With a 3-arm trial, there could be 3 comparisons between the 3 arms if you were looking at all 3 pairwise comparisons. And so you get into multiple hypothesis testing there. So these examples, just to make them a little more concrete, I also have shown an exact an actual example here for multiple primary endpoints in a two-arm trial could be that you are interested in, so I'm in the Heart, Lung, and Blood Institute. We look at blood pressure a lot sometimes. So an example would be we're interested in comparing the two arms in their control of systolic blood pressure as one aim, and a second aim would be we're interested in comparing the arms on the control of diastolic blood pressure. So that would be an example of having multiple primary endpoints in a two-arm trial. With a three-arm trial, the arms could be various things, but in a typical example would be that you have two of them are intervention or new active agents, say A and B, and the third one, C, is a control agent or a standard of care in some cases. Could be placebo in other cases. But in any case, it's going to be used as a control to compare against. And in theory, you could have up to 3 possible comparisons of interest there among those 3 arms. That is A versus C, B versus C, which are the 2 active arm versus control comparisons. And also you could be interested in comparing the 2 active arms, A versus B. So as we go through it, I'm going to come back to those examples. Things that I'm not going to talk about are trials with FDA oversight. There are some additional issues that FDA is interested in that I'm not an expert on and don't have a lot of experience with, so I'm not going to address that today. There are a big issue in multiple comparison over secondary aims and how important it is to control and what errors you may control with secondary aims. So I'm going to really try to stick just to the simplest case where it really is a primary aim that you want to make a claim on in a confirmatory trial. So we'll not be talking about secondary aims. And then the final thing is the name of the talk that I chose is alpha spending for clinical trials, but I realized afterwards that it's a little bit close to what we refer to as alpha spending functions, which is something that is used in monitoring trials as data accumulate. And that is a related topic in the sense that there is an error there that is interested in controlling over multiple chances to make that error, but it's a little different in that they're not actually multiple different hypotheses necessarily there. It could be a single hypothesis. You're just able to test it when you, as the data accumulate, you're testing that same hypothesis, and there's a whole different field about that, and I don't have time to go into that. So I'm going to stick just to multiple hypothesis testing and not monitoring trials as data accumulate. So the thing that I talked about at the very beginning was that I'm going to have to talk about what errors are interesting. And for a confirmatory, the standard thing that you may have encountered is the familywise error. And the familywise error of a collection of null hypotheses is the probability that any true null hypothesis in the collection is rejected. So this is the reason why you may want to control this is that if you're going to make a claim based on any null being rejected, then you want to make sure that none of your claims are false. And that's the idea of the familywise error. I can't have an error on any of my rejections of a null hypothesis. And strong control says that this familywise error has to have its maximum has to be less than or equal to alpha. So that's the sense that it has to be controlled in the strong sense means that under any configuration of true or false null hypotheses, you always have to have that there's no more than an alpha chance that you will make a false rejection. And for this presentation, those null hypotheses are going to be, the family of interest is going to be the family that corresponds to the primary aims that I talked about, the primary aims of the trial, which could either come through, in the examples I'm going to talk about, through multiple primary endpoints or multiple arms. Now, there's also weak control. Weak control just says that the familywise error is always less than or equal to alpha in the specific case that all nulls are true. That is only one special case of what there could always be. Nulls could be true. Some nulls could be true. Some nulls could be false in general. And so this is a specific special case. And therefore, strong control always implies weak control. And weak control isn't good enough, really, because we don't know that all the nulls are true. So it's an assumption that you just can't make. And so that's not normally good enough control for a confirmatory trial to control weakly the familywise error. Now, I mentioned secondary endpoints, and that I'm not going to really talk about it, and I'm not going to talk about all the other possible error rates as well. Perhaps these are error rates that might be appropriate in some cases for secondary endpoints. They could be appropriate in many other circumstances, but I'm going to stick to the family-wise error. But there are, just so that you know, there are many other types of errors. The most commonly encountered would be the false discovery rate. And that basically is a ratio of rejections. And the false discovery proportion, which is also that ratio, but the false discovery rate is an expectation of that. So you can actually control the false discovery proportion or the number of false discoveries. And that was given the name KFWER by Lehman and Romano. So those are other possible errors that might have interest in certain applications, but I'm going to be talking today about methods that control strongly the family-wise error over the family of primary aim hypotheses. Okay. Probably all of you have heard of and used the Bonferroni, the simplest of all methods that control the family-wise error rate. So for some concreteness, to be able to describe these methods, I need to have some notation. So I'm going to let the null hypotheses be denoted H1, H2 up to H capital K, and the corresponding p-values P1, P2 up to P capital K. Then very simply, the Bonferroni procedure says that you get to reject each hypothesis Hj that has a p-value Pj less than or equal to alpha over K. And so that is basically, you've partitioned the total alpha that you have to make for family-wise errors, and you've partitioned to each hypothesis by dividing your alpha into groups of alpha over K different alpha over K groups, if you want. And then you get, that's one way to think of it, is you're partitioning alpha. And so that's a method of spending alpha if you want. You allow alpha over K to each hypothesis. And so the Bonferroni procedure requires no assumption, and it strongly controls the family-wise error. The problem with the Bonferroni is it's can be very low power because it's extremely conservative, especially when there's correlation between the test statistics that you're using. In other words, are the p-values, if you want. If those p-values are highly correlated, then the Bonferroni will have, other methods could increase power greatly over the Bonferroni, put it that way. Now, there's other ways in which the Bonferroni is also conservative, and that is that it is conservative in the sense that it doesn't consider what happens once you've made one rejection. It applies that same alpha over K to each hypothesis. And there are ways to account for the fact that once you've rejected one null hypothesis, you don't have to really worry about it, in the sense that you've either already made a type 1 error, or you only have to worry about K-1 true null hypotheses that could be true. And so what the Holm does, Holm is what the stepwise extensions do in general, and the Holm in particular, is that they order the p-values. So if you let p sub 1, the bracket is the indicating that I'm looking at ordered p-values and ordered hypotheses. So if p sub 1, I'm just going to say sub 1 is less than or equal to p sub 2 is less than or equal to p sub k, the ordered p-values, if that's the notation for those, and then we think about the hypotheses that correspond to those p-values and let those be denoted h sub 1 up to h sub k, then the Holm procedure says we start out when j is 1, and we reject h sub 1 if p sub 1 is less than alpha over k. So when j is 1, you get alpha over k plus 1 minus j, you just get alpha over k. So for the first hypothesis, it's exactly this. For the first ordered hypothesis in this ordering, you get to look, and if the p-value corresponding to it, which is the smallest p-value, is less than alpha over k, same as the Bonferroni, you get to reject that hypothesis. But what the Holm says is that if that happens, then I get to go on to the second hypothesis in this order, and I look at the p-value p sub 2, which is the second smallest p-value, and I get to reject the corresponding hypothesis if that p-value is less than alpha over, now it's k plus 1 minus 2, so therefore it's k-1. So the denominator goes down. Each time that you rejected at the previous step, you get to reduce your denominator. And so instead of looking at alpha over k like you would with the Bonferroni, now when you look at the second smallest p-value, you get to reject if it's less than alpha over k-1. And then if you reject that one, you get to reduce that denominator further as you keep going. You have to stop, though, the first time that you do not reject. So, but the idea is that since you're in the Bonferroni, you wouldn't get any rejections anyway if you didn't get through that first step. So you might as well do it this way. You can always increase your power. This is strictly more powerful than the Bonferroni. And it also strongly controls the familywise error. Intuitively, as I said at the beginning, either a null hypothesis is either true and it was already rejected, so you've already made a type 1 error, or you can basically remove it from consideration and reduce that denominator by 1. Now, the problem with the Holm, in comparing it to the Bonferroni, it also requires no assumption. The only problem is that it only helps you in terms of power for subsequent rejections after the first. Because remember, that first one, you look at the smallest p-value and you only get to reject it if p1 is less than alpha over k, the same as the Bonferroni. So it does not help you get the first rejection. And since that's the smallest p-value, you won't get any rejections if you don't get the first. So, and you have to stop anyway. So, but it will help you get multiple rejections. Okay, so I will talk later in the talk about methods to tighten up the Bonferroni for that first rejection. But in the same vein, there are other extensions of the stepwise method from Holm, and that is that you could get even more power from a stepwise method if there are logical restrictions among the hypotheses. And that happens for example, in multi-arm trials, which is the two toy examples that I'm going to go back to when I start illustrating some of these methods. Is going to be the second one is going to be a multi-arm trial, 3 or more arms. And when you do that, I'm going to explain there is a logical restriction that can come up. But for now, I'm going to express it in the general terms. And basically, in general, anytime there's a logical restriction of any type, if you know that there are, it means that you might have at any stage when you're going through this stepwise rejections, you may have that instead of k plus 1 minus j as your denominator, you may know that at that stage there cannot be more than rj untested true nulls at step j. So that's what I'm defining rj to be. And if you know that this rj could be smaller than k plus 1 minus j, and if that is true, then you can use rj instead of k plus 1 minus j at step j. So that's what that says there. You can reject p sub j, the hypothesis corresponding to p sub j, if p sub j is less than or equal to alpha over rj, and all previous hypotheses have been rejected in this sequential method. This can get even more powerful than the Holm, because you're reducing the denominator that you're dividing alpha by at that step. And this also, by the exact same reasoning, it also controls strongly the family-wise error. Okay, now there are a lot of other things that you can do, and as I mentioned, the Bonferroni is very conservative when there's a high amount of correlation between the p-values or the test statistics. And one of the things that will improve power over the Bonferroni, even in power in the sense of getting any rejections, so that first rejection, will be to account for that correlation. And one of the ways that this can be done is through resampling, which there are variations on that, but I'm just mentioning one of the most popular and one of the first reported ones is the method of Westphal and Young step down with resampling method of multiple testing, which is documented in proc mult test in SAS and a package in R there and rejections. And those methods can increase power even for that first rejection over the Bonferroni. Now, all of those methods, the resampling methods, basically need some kind of assumption. So you can't get this completely free. Like the methods that I've talked about in the past, or up to now, all were without any assumption, other than that the p-values themselves had to be valid p-values. They make no assumption on the distribution between the test statistics or the p-values or anything like that. In this case, there is, and the Westphal and Young method has a technical condition I'm not going to go into, but it's called subset pivotality. And so if you know about that, there is a case where if you're looking at multiple outcomes being compared between two groups, and you're looking at the mean level of the outcomes, So mean comparison between two groups, that's automatically, subset pivotality condition, for example, is automatically met in that case. So that's a case where, even though it's an assumption, it's known to be true. And so you can automatically use, for example, the Westphal-Young method in that case, and it would strongly control the family-wise error asymptotically. Okay. So now there's a few other methods that are, so I'm only going through, there's lots of methods, of course. I'm not going to go through, in any kind of exhaustive way, but I mentioned resampling as a general area. There are others that are more or less about the strategy of how you test, not so much about within each test is still based, similar to before in a sequential method, but it's basically the strategy of how you're going to do that. And it gets back to this idea, I talked about Bonferroni's already, is like deciding how you're going to spend your alpha. Well, the home essentially decides how you're going to spend the alpha, but it also kind of redistributes the alpha in a sense. And that's the idea that you basically, that's the way you can reduce that denominator as you go through the home method sequentially. That can be thought of, and we're going to get to that later when we talk about graphical methods. It can be thought of as redistributing that alpha. Well, a fixed sequence is another way in which you can kind of think about strategizing and allocating your alpha. And the idea in the fixed sequence is that you basically, you really put all your eggs in your first hypothesis, and you come up with a pre-specified order. And then you decide, though, that you're going to stick to that pre-specified order, but you can, which means that you can only get to the second hypothesis in this order if you get to reject the first. But if you do that, then the fixed sequence method says I get to sequentially reject the method hypothesis HJ if PJ is less than or equal to alpha. I don't have to divide my alpha, but I get to do this, but the order has to be predetermined. And then if I reject the first hypothesis this way, I then get to test the second at the same level alpha, and I can continue. But the first time I don't get a rejection, again, you have to stop, just like in the home procedure. So this, in a sense, is recycling the alpha in a certain sense. And if you get a rejection, you can then pass that alpha on to the second hypothesis. That's one way to think of this, or look at this. And so in that sense, it's a recycling of alpha only under the case that you get a rejection. This is very good in a sense if that order really is how you, it's only important to go to the second hypothesis if you reject the first, then this is a really good idea. It can be very dangerous though, because remember, once you get don't reject, you have to stop. So if you put all your eggs in that first basket, you don't reject, you're done. So it's all or nothing kind of a way to approach this. More generally, this is that fixed sequence is something that's one part of a more general thing called a serial gatekeeper. And in a serial gatekeeper, in general, you could have families of hypotheses that you separate your hypotheses, all of the hypotheses that you want to control your family-wise error over, into subsets of hypotheses. I'm calling those F1 up to FQ, capital Q. And you do that pre-trial. Again, you have to do that pre-trial. And then you can go through sequentially, and you can test the families by some method. Okay, you can, and I'm not saying exactly what the method is, but you test the families by some method. But you get to test family FJ if all previous families have been exhaustively rejected. And if that's the case, then the serial gatekeeper will strongly control the family-wise error as long as the method that you use to test within family FJ, which I didn't specify here, also controls within that family. But then that subfamily, FJ, if it controls family-wise error strongly, then the whole overall procedure will control among all of the hypotheses in F1 up to FQ, will control strongly the family-wise error. So that's the more general idea of a serial gatekeeper. But this is very stringent in the sense that you have to have exhaustively rejected the family F1 before you can go on to family F2. And it's the same thing for family F2 before you go on to family F3. A little more practical, perhaps. Well, anyway, another one that happens to be, I find, often cases is useful is a multi-stage gatekeeper, which is starts out very similarly in that you create your hypotheses into subfamilies F1 up to FQ before the trial in a pre-specified order again. But now you can test family FJ as long as all previous families have had at least one rejected hypothesis. So this allows for, it's a lot less all or nothing in the sense that all you need is at least one rejection to go on to the next family. Now, the downside of this is that I haven't told you exactly how you have to test those families within FJ in order for it to control family-wise error. And in general, it will not control family-wise error if you just try to do anything. So here's an example. The next slide, I'm going to talk about a specific multi-stage gatekeeper that does control family-wise error. And so this is, I've put this because I think this is kind of where one way that tends to come out to be very useful, I think, is in a case where the simplest case I could think of, when you have two families, F1 and F2, that you're willing to order them by this method. F1 is more important than F2, so I'm going to test F1 first. And F1 has K hypotheses, capital K hypotheses in it. Then what you do is, what does work is if you use Bonferroni to test among F1 first. So I first get to test family F1 using Bonferroni, which means that I can test each hypothesis within F1 by comparing its p-value to alpha over K. And then I get to go on to hypothesis family F2 if I got at least one rejection. And the question is, what alpha can I carry over to the second family? And that is basically, you can carry over alpha over K for each rejection that you got in the first family. If you use Bonferroni in the first family, then this allows you to then do, and then in the second family, you carry over alpha star, which is alpha times R over K, where R is the number of rejected hypotheses in F1. So essentially, you can think of it as recycling each of the alpha over Ks that were used at that first stage for the first family that got rejected. Whenever you reject it, you get to take alpha over K and recycle it into the second family. And that accumulates to alpha times R over K. And then among that second family, F2, you start out at alpha times R over K, but you have to further divide it. If there's multiple hypotheses in F2, you have to further divide it using Holmes procedure to then control family-wise error within F2. If you do that, then this multi-stage gatekeeper will control family-wise error over all the hypotheses in F1 and F2 strongly. And I'll give examples of a multi-stage gatekeeper of this type later. We'll go back to this example again. Now, many of these, in fact, almost everything I've talked about so far, many of them can be described by this approach that I said was I think very interesting, and that is called a graphical approach. And so this assumes that you have your hypotheses, and pre-trial you have your H1 up to HK, and pre-trial you determine initial allocations, alpha 1 up to alpha K, that add up to alpha. Okay, so you basically decide how you're initially going to divide your alpha, and then you determine for each hypothesis how your alpha J will be recycled or or distributed if you want, if HJ is rejected. And so this gets back to this idea of the recycling of the alpha. This basically allows you to do it, but you have to predetermine exactly how it's going to be redistributed. And I'll explain that by example on these graphs. The graphs will show you how that's being determined. But basically, if you do that, then the graphical procedure says if you reject any HJ if PJ is less than alpha J first, so that's the initial allocations. But then also, if any hypotheses are rejected, you then look at your graph and you can redistribute the alpha J according to the rules that you determined, and you can retest all the hypotheses. And if you get any more new rejections, because the alphas have increased at some of the nodes in your graph, which correspond to hypotheses, then you get to reject those hypotheses too, and you get to again redistribute that from those being rejected, and you can continue until you've tested everything until you get no rejections. Basically, this procedure will strongly control the family-wise error at level alpha. So we're gonna go through some of these examples to show what the graphical. If you didn't understand the graphical, it should become clear from some of these examples. So these are again this is just the remind you of the examples that we're going to go through. We've already talked about these. So this is the most simple is the Bonferroni. So for multiple primary endpoints, if I have two endpoints, H1 and H2, all the Bonferroni does is it says I'm just going to give the initial allocations alpha over 2, alpha over 2. There's no arrows connecting these to show you how you would recycle these alphas. And that's the problem with the Bonferroni. It's why it's not, you can tell that Bonferroni is not optimal in any sense because it doesn't recycle the alpha. But that's basically what the Bonferroni does. Now, we talked about the home. So what does the home look like on a graphical? This is the algebraic expression of home with two primary endpoints. You reject H1 if P1 is less than alpha over 2, and you reject P sub 2, you ordered based on the ordering, if it's less than or equal to alpha. And then you can reject the corresponding hypothesis H sub 2 if that p-value, and you rejected the previous hypothesis. What does that look like graphically? It's like this very simply. It's the same. It starts out the same as the Bonferroni. You put alpha over 2 here, alpha over 2 here, but it says I'm going to recycle these alphas. If I get a rejection here, there's nowhere else to go, so I might as well put it all over here. And if I ever get a rejection here, there's nowhere else to go. I'm going to throw it all over there. And this is exactly what the home is, if you think about it, because first of all, this graph is symmetric, so it doesn't matter which p-value is smaller, right? So if I just say without loss of generality, this p-value is turns out to be the smallest one. I'm not assuming it was, but if this turned out to be the smaller p-value, I'm comparing it to alpha over 2. That's exactly what you do in the first step of the home. If I reject, I get to push it all over here, and then I get alpha over 2 plus alpha over 2 here, which is alpha. And I test the larger p-value with alpha. That's exactly what the second step says for home. So this is exactly identical to home. What does a fixed sequence look like? This is just to remind you what a fixed sequence is algebraically. You just determine the order ahead of time, and then you test if P1 is less than alpha, you get to reject that hypothesis. If P2 is less than alpha and you rejected the first hypothesis, you get to reject the second. This is what it looks like graphically. You're putting all of your eggs initially in this basket, but you're also allowing yourself to push that alpha over to the second hypothesis if it gets rejected by the first hypothesis, by the p-value for the first hypothesis. So that's what it looks like. With a 3-arm trial, this is just reminding you what those comparisons are. The 2 active arms compared to control are H1 and H2. A versus C, B versus C, and then the 2 active arms compared to each other is the third hypothesis, H3. What you would do with home is you would just look at the ordered p-values and you'd say the hypothesis corresponding to the smallest p-value is rejected if that p-value is less than or equal to alpha over 3. If you get to reject that, you can go on and look at the second smallest p-value and reject that hypothesis if it's less than or equal, if that p-value is less than or equal to alpha over 2. And then if both of those are rejected, you can go on and look at the third or the largest hypothesis p-value, hypothesis corresponding to that, and you reject that if that p-value is less than or equal to alpha. And it's basically very simple. Each hypothesis, you're gonna start with alpha over 3, and then you're gonna have 1/2 proportion of the alpha that sits at that node is going to be pushed over here and half pushed here. So it's symmetric. It considers all the hypotheses symmetrically, just like in the two-arm trial. And it ends up being exactly identical to the algebraic expression here. If you think about it based on the fact that this is symmetric, I could just assume this is the smallest. And then if that's the case, I'm going to push half of it over here, which is alpha over 6. And then alpha over 3 plus alpha over 6 just happens to be exactly alpha over 2. And the same thing goes down over here. You get alpha over 2. And so once you've rejected one, you get rid of this node and you have alpha over 2 and alpha over 2 for the second comparison. And then again, if you reject the second, you're then going to push that alpha over 2. There's nowhere else. You can't push it back this way. So you get to push everything essentially over this way and you get alpha over 3. So it ends up being, you get alpha at the final comparison. So it ends up being identical. Now, I talked about logical restrictions, and that the 3-arm trial is the example where that's true, because when you're doing pairwise comparisons in a 3-arm trial, and you're looking at means of each arm, and your hypothesis is that the mean is the same in the 2 arms, there's no way to have exactly 2 of these nulls to be true. That is because if you, in the example given, suppose A is equal to B in mean, and arm B has the same mean as arm C. Those are the hypothesis H1 was true and hypothesis H2 is true. Well, if that's the case, then automatically you have that the mean of A is the same as the mean of C. A is the same as B. If you have A is the same as C and B is the same as C, then you have A is the same as B. So you cannot have 2 of exactly 2. And so this comes out in the second stage of the home. Instead of having alpha over 2, you actually have that maximum number of true hypotheses, once you've rejected one, is that there can no longer be exactly 2 true. It has to be exactly 1. It can only be 1 or none. And so you get to reduce that denominator down to 1. And so you get to compare your second p-value immediately down to just comparing it with alpha. And then it stays at alpha in the third comparison. That's the example. Now, that's the example of home with a logical restriction on the 3-arm trial with pairwise comparisons. The only problem is this is not part of the graphical. It cannot be described graphically, so it doesn't fall within the graphical method. Now, what does a fixed sequence look like for the 3-arm trial? This is just reminding you, basically, you're just going to look one at a time, and you just compare each p-value to alpha. As long as you keep rejecting, you can keep pushing it down the line. That's exactly what it looks like graphically. You just start with alpha here, and if you reject, you get to push it to H2 and test H2. If you get to reject it, then you push it over to H3 and reject and you test H3. Okay, a 3-arm trial with a multi-stage gatekeeper. Now, I'm bringing this up because this often makes sense that you, as I mentioned before, in a 3-arm trial, you may be interested, first of all, in testing the 2 active arms to the control. That would make a lot of sense in many cases, because if you don't have a comparison with a control that's significantly different, then it may not be worthwhile to even look at whether the 2 arms are the same, active arms. So first thing you want to do is compare with a control, say. In this case, what you do is you put those 2 hypotheses in family 1, and then your comparison of the 2 active arms, which is H3, is in the second family. Then you might want to put all your weight on first comparing family 1, and then only if you get a rejection in family 1, you go on to family 2. So you would do that by this multi-stage gatekeeper that I described before, which means you use Bonferroni in the first family. So if there's two hypotheses in the first family, I'm going to have to split alpha to alpha over 2. And I'm going to test each of them at alpha over 2, just like that. And then if I get a rejection, or if I get 2 rejections, 1 or more, I'm going to take however much alpha I can get out of this. If I get 2 rejections, I can pull alpha out of this. If I only get 1, I can only pull alpha over 2, and I'm going to send it down here. And in stage 2, I'm going to test. In this case, before I said you can use, say, Holm procedure in the second, but here is only 1 hypothesis. So I get to just test it. And if P3 is less than or equal to R times alpha, where R is the number rejected in the first stage, over 2, then that would control the family-wise error strongly over all 3 hypotheses. And what does that look like graphically? That's very simply described by my initial allocations according to Bonferroni. So I've ordered the hypotheses. I've done the diagram such that the first two hypotheses are at the top. My family 1 is across the top, and family 2 is down here. So my initial allocations are just to family 1, H alpha over 2 to each of these 2. But I've said, if I reject, I'm only using Bonferroni in the first family. I can't recycle back and forth here. That's the only downside of the multi-stage gatekeeper. But if I do get a rejection for either one, I get to push that amount down to test the second family down here. That's what that multi-stage gatekeeper does. And often that makes a lot of sense. Okay, I have some examples. So those were my toy examples. Now the actual trial examples from NHLBI. So I have a nudge trial. The nudge trial was a pragmatic, individually randomized trial to test effect of nudges on medication adherence in 3 health systems in Colorado. This trial had 4 arms. There was a generic nudge, there was an optimized nudge, and there's an optimized nudge plus a chatbot. So I was trying to get people to make sure that they filled their prescriptions so that they would be able to take their drugs. And then there was a usual care, which basically did not send them nudges. And so that's the comparison arm. And the outcome was the proportion of days that they had medication supply to cover their prescription over 12 months, determined by looking at prescription refill information in the pharmacy records. Now here, there's 4-arm trial. There's actually 6 pairwise comparisons possible. Nudge was interested in all 6, but they prioritized the active arm comparisons against the control arm. So A versus D, B versus D, C versus D are their first 3 hypotheses that I'm going to put in the first family. And then the other comparisons among the active arms are the second family, A versus B, A versus C, and B versus C. Now, this is what it looks like graphically. It looks really complex, but this does not take a whole lot. It's a lot easier to think about this just thinking about that multi-stage gatekeeper standpoint, that all it's doing is looking at these first 3 hypotheses across the top row, and it's using a Bonferroni among them. So it puts alpha over 3 initially to each of those 3. And then it has equal amounts, arrows going with equal amounts going from each of those to each of the second family hypotheses across the bottom. And then because once you've gotten past the first family and you're your final family, you can then use home procedure. This describes down here is these guys get to recycle back and forth among themselves according to home procedure, with whatever gets through the first family gets down here, then gets recycled if there's any rejections in the second family. But it looks really complex, but it's actually just using Bonferroni for the first family and then taking whatever you get to recycle down to the second family and using home. So, and then another second example is this bone marrow transplant trial, 0702. It's an NHLBI sponsored bone marrow trial. It was a 3-arm trial of individually randomized 758 patients with symptomatic multiple myeloma. It had 3 arms. All arms had this lenalidomide maintenance, LEN, abbreviated LEN. But the 3 arms, the basic difference between them was the main level of treatment was a tandem AHCT, an AHCT combination with RVD, and AHCT by itself. And AHCT at the time this trial started was the standard of care. So that's ordered again as I have done before in the multi-arm trial. I'm going to use that as my control arm, and I'm going to consider the 3 hypotheses comparing, the active arms to the control arm and then the active arms to each other. Outcome for this trial was progression-free survival at 38 months. And the trial specified a Bonferroni to be used among all 3 pairwise comparisons of H1, H2, and H3. So again, these are the two comparisons of active against control, and then the third comparison is the 2 active arms, A and B. And this is the actual progression-free survival percentages in the 3 arms at the end of the trial. Using Bonferroni, you have to test them with a p-value cutoff of 0.0167, and none of them turned out to be significantly different. But I thought it's interesting to think here what other possibilities might one have thought about. Obviously, this is after the fact, but I'm just thinking about things that you might think about in a trial like this. You could have thought about perhaps using that multi-stage gatekeeper over H1, H2 as the initial family, and then only testing H3 after if you got a rejection on H1 and H2, or even further, you might have just tested H1 and H2, and that's it. And that either of those would have allowed you to at least test H1 and H2 at 0.025 level. If you did say the multi-stage gatekeeper I just showed, or similar to the one I just showed for nudge, actually, but it's different because here there's only 3 arms. But you would split that alpha in the first 2 based on Bonferroni, and so you would have had a chance of perhaps getting a rejection on the first. I don't know whether it would have or not, but the point is this would have given you a little bit better chance to get at least 1 rejection. Wouldn't have helped you with it would have helped. Okay, there's other considerations about supposing another possibility would be, say you used home. In this case, with a 3-arm trial with pairwise comparisons, if you're interested in all of them, you would be able to get more power for secondary rejections because there is logical restrictions with the home. However, you wouldn't have a better chance to get that first rejection. So, and as it turns out, you wouldn't have gotten any rejections in this case if you'd used home with logical restrictions. Another possibility that also raises the power like this one for that first rejection would have been to use resampling methods because they can have more power for that first rejection than a Bonferroni. So my conclusions are there is this simple graphical approach, which I think is very intuitive and can be used to strategize and efficiently test multiple primary hypotheses. Each hypothesis is given an initial alpha allocation, and if rejected, you can recycle the alpha to other hypotheses according to a pre-specified algorithm. The graphical approach strongly controls the familywise error at the sum of the initial alphas. It's very useful. There are a couple of notable cases where you may want to consider other things and one of them, and within the graphical approach, there's the multi-stage gatekeeper to prioritize initial families. That's something to think about. Not in the graphical is the logical restrictions that can be helpful sometimes if you're going to use, for example, a stepwise method like the home procedure. It only applies when there are those logical restrictions, though, and it cannot be used in combined with the graphical. And also not within the graphical is resampling methods that can improve power, especially when test statistics are highly correlated. And that is the end of my presentation.
Thank you very much, Dr. Troendle. You're able to cover a lot of material in a limited amount of time. And there are a bunch of questions.
Okay.
Start with something simple. Is it correct to say that we don't have to worry about these issues if we have a two-arm trial and one primary outcome?
Correct. For now, there's still the issue of secondary outcomes, and the level of scrutiny of the trial. Sometimes secondary outcomes can be very highly scrutinized. But in terms of the way I framed it today, I was only focusing on the primary aims of the trial. And so in that case that you've described, yes, there would just be one hypothesis that you're going to test. Now, it gets into when you talk about if you're going to make something of a secondary outcome and you don't have a significant primary, then of course there could be still some consideration to multiple hypothesis consideration there. You're probably not going to be able to make too much of a secondary outcome if you don't have a significance in the primary, or unless you've baked it into your rules.
Yeah, and my guess is that you're going to say yes to this question, which is, do you have to have all of this stuff written up in the protocol?
Right. So for it to be obviously to be most persuasive and for journals to be able to take you at most highly at face value, you're going to want to be able to say that this was all pre-specified in your protocol. So yes, if it's not, of course, that opens the possibility for all kinds of gaming or cheating that could have occurred. And so in the strictest case, this should all be pre-specified, certainly before before any outcome data are looked at in a trial. Typically, sometimes we allow protocols change a bit as trials are underway, but once outcome data are looked at, then this should all be specified.
Okay, so there might be a little room to maneuver before the data are cleaned and the analysis starts, but
if you haven't looked at right,
needs to be written down.
Right.
We have a question about the graphical methods that you presented today. Is there software available for that will generate those graphs, or are these available in a journal article somewhere?
So I gave the reference here. The one at the bottom, I think, is the main reference for that.
Brett's.
Frank Bretz is, I think, the first author of that. I'm not aware of software for it. I think there may be, though. I'm not aware of it. But yeah,
Okay.
it's very, you can just kind of draw these yourself and see how things will work out.
You didn't speak to interim tests. The focus in the discussion today was on evaluating outcomes at whatever the primary endpoint was, 1 year or 3 months or whatever it was. What about if there are interim tests? That has to affect the alpha levels. Is that a whole nother presentation? We need to have you back for that.
Well, I don't know about me, but certainly it is a whole nother presentation. That's the reason why I stayed out of it, because I could just barely get through what I had. But yes, essentially, in the easiest cases, if you're just looking at one outcome, you still have an issue if you're looking at data as it accumulates, in that you may have a rule, or even if you don't have a rule, you may decide to stop the trial early. And in that case, you really need to be thinking about formally spending alpha as time goes on, according to an alpha spending function. In the simplest case, if you have both of these going on, you would apply everything that basically as you go along, your alpha spending function tells you how much alpha you can spend at that look, and it'll tell you how much alpha you can spend at your final look. And everything today I said could be that final alpha, then has to be the starting alpha, which you start with. You could then apply all the methods that I talked about today with that alpha that you're going to spend on your final look.
One of our member of our audience is asking about Bayesian approaches. You've been talking about things that I think would fall into the frequentist category. Are there Bayesian alternatives to in this area?
So formally, I don't believe Bayesians formally recognize an issue, an issue in terms of multiple hypothesis testing. Now, in practice, we do run Bayesian trials at NHLBI, and if it's a confirmatory trial, typically we will insist, or they will usually plan it that way anyway, to have some kind of type 1 error. And so in that case, it ends up being much like a frequentist trial in the final actual parameters, but you can still use a prior, you can still do the analysis by a Bayesian method, you can talk about a posterior. Typically there's simulations are required to verify that the type 1 error rate is controlled. And if that's the case, then that will tend to restrict the final analysis to look much like a frequentist analysis. It'll kind of align. Typically that will force that there's not going to be it's going to be extremely uninformative prior, and it will end up looking very much like a frequentist trial. But we do handle Bayesian trials at NHLBI, for example. But typically, I mean, formally, I don't think Bayesians, recognize multiple comparison as a problem.
Okay. You described a number of methods. We all learned about Bonferroni as grad students, and we know it does a good job of protecting the family-wise error rate, but can be conservative. And you described a number of alternatives: home, fixed sequence, serial gatekeeper, multi-stage gatekeeper, and there may be a few others that were mentioned, and I didn't write them down. Are they all equally good at protecting the family-wise error rate?
So the only things that all the methods I talked about control the family-wise error rate with basically no assumption other than the p-values are valid, except I think the resampling methods I mentioned, they all require some assumption. Mostly I was focusing on these simple recycling of alpha ideas, the stepwise methods essentially, and the variations of them within the graphical. But there's of course many other specific cases of specific trials, for example, pairwise comparisons, all comparisons with a control, that where people have worked on and come up with specialized methods for. I was trying to stick to cases that more or less apply without any assumption. And so that's what all of the ones that I talked about today, except for the resampling, which does require some assumption.
Okay. One of the questions that often comes up is when we talk about methods that are not so familiar to everybody, how well received are these methods in review? If an application goes to CSR and it talks about using a fixed sequence procedure or a home procedure, is that going to fly with the review panel? Are people going to throw up their arms and say, what are these folks talking about?
So I think that the things that I talked about are pretty well established. Almost anything I would say that I was talking about today, I would expect that they'd be understood, certainly with explanation, perhaps some of them, but Holm, Bonferroni, all this, the fixed sequence, those are very well in the literature. And of course, there's always possibility that a reviewer will not understand it right away, but those, or be familiar with them, but those are pretty standard. I don't think you'll likely encounter much pushback. I think the most I got out the furthest into complexity probably when I was talking about some of these multi-stage gatekeepers. Those can of course get much more complex, but I gave you kind of the simplest, where you use a Bonferroni in the first family and then you use a Holm in the second family from whatever alpha that you can take out of the first family. That's kind of as simple as it gets with a multi-stage gatekeeper. And I think that's from this Dmitrienko reference at the second to last.
Okay.
And that I think you might have to point out, a reviewer may not be familiar with that. That's quite possible. That gets into a little more technical, but you could, with pointing out that this is in this journal article, I think it's pretty well established from the statisticians.
Yeah, a question that just came in your gatekeeper approaches, you did use Bonferroni in the first stage, and then I think you used Holm in the second stage. Would you ever use Holm in the first stage as well, because it has more power?
Right. So for the multi-stage gatekeeper, in general, there's a real technical restriction to use a multi-stage gatekeeper. In the first stage, you can't use It has to be called an alpha exhaustive method, which Bonferroni is an example of. And so it's an open, I think, question. Is case by case, I should say. There's the technical details are given in the paper as to what you need to have, but you cannot, for example, you cannot use Holm in the first stage in general.
Okay.
So that shoots that down. There's a more technical condition that has to be met.
All right.
Basically, you don't know what alpha. Basically, the problem is you don't know what alpha can be brought to the second stage if you use Holm on the first stage. So it's not so clear.
It seems pretty clear from what you've been presenting today that there are methods that are better than just using Bonferroni.
Right.
They seem quite straightforward to you because you've been working with them for a long time. I suspect they seem far less straightforward to many of the people listening and watching. How do investigators find a methodologist who understands all this stuff and can help them plan their trial?
Well, I mean, that's a tough question for me to answer. I think within NIH we have statistical groups, but in general I don't know how to answer that. I think that they are right that this can get very complex, especially when you go into the resampling. The ones that I focused on today are things that I think the problem is most of the methods that are simplest to understand, like the graphical, for the most part, are not going to improve your chance of any rejection. And so, there are the main way to do that is either to strategize through that first family, reduce that first family. If you're going to use a multi-stage gatekeeper, for example, then you can improve that chance of the first rejection because you reduce the number at which you're going to adjust for at the very first step. Or resampling, and the resampling is very technical, and so you need a statistician to help you with that. But I'd say the others help you mainly in getting more than one rejection, and that may not be as important to investigators as getting that first rejection.
Yeah. Are these methods going to be familiar to most statisticians or most biostatisticians, or do we need to look for somebody who specializes in this?
Well, I think most of these will be somewhat familiar. I don't know about very familiar, but somewhat familiar to people who work on clinical trials a lot. So
Okay.
I think, it depends, but you have to find somebody with clinical trial experience. Perhaps if you really want to use resampling, you may need to investigate into somebody who really has research in that area.
Most of the conversation today has been around alpha. The other part of this, of course, is power. And I can't imagine that these methods don't have some impact on power. Are there methods available to estimate sample size to provide sufficient power for these complex alpha spending methods?
Good question. I don't know of a good resource for it other than, now, of course, again, most of the emphasis may be on getting that first rejection. And so if you're going to be looking at, say, a power of a trial, you may, if you're going to use, say, even a Holm procedure, you might just power that trial based on alpha over K for your most important hypothesis, and therefore you could do a power calculation that way. In terms of what your power is, averaging power over hypotheses, for example, in a multiple hypothesis testing case, I'm not familiar with good software to do that. That would be a lot more complex. I think probably.
But setting the power up for the first stage,
I think
probably makes a lot of sense to me.
Yeah, I think that's probably what you're going to end up doing if you're using a stepwise method. Is you're just going to look at alpha over K and see what the power is for that.
Right. All right. We are coming up on the top of the hour. We have questions that I've not been able to ask, but let's try to squeeze one last one in. Are there packages in R or procedures in SAS that implement many of these procedures?
So there are various packages. I mentioned a few. There are, of course, R has lots of things and lots of specialized types of things. I think if you're looking at these most simple ones, like the Holm, you really don't need a package. It's very simple to just calculate it. In most cases, if you're thinking about some of the more complex stuff, like the resampling, you're probably going to need to look at specialized packages in R or in SAS. And I've given a few of them. I'm sorry, I don't have better answers than that.
Dr. Troendle, I want to thank you very much. Terrific presentation and a fun discussion. I'm going to turn things back over to Dr. Moyer to wrap up.
Thank you.
Thank you, Dr. Murray and Dr. Troendle, and thank you to everyone who participated in today's webinar. On the Mind the Gap website, prevention.nih.gov/mindthegap, you will find several resources for this talk, including the slides and a list of references. We will also be posting a recording of today's webinar on our website in a few weeks. Thank you and have a great rest of your day.